In 2024, people got a letter that were on Medicare Part D, thousands and thousands of people, and they didn't read it. They didn't read that letter. They were happy with their Part D, and they get a lot of mail just like you and me, and they just threw it away. And in that letter, it said your Part D plan monthly premium is going to double or triple. Well, they didn't read that. They didn't take advantage of the annual election period, which is October 15th through December 7th, to change their drug plan. So in January, when they went to use their drug plan, they called us furiously. They're like, what happened? My plan doubled or tripled. Help me change my plan. Well, you can't do that. If you want to change your drug plan, you have to do it in the fall of the year. Now, if you move into another state or something special happens, sometimes we can move you outside of that window. But for 60 million people, the majority of you have to make that change in the fall. You will get a letter again this year and every year if you have a Part D drug plan or you have a Medicare Advantage plan with the drug benefits built in. It's called your annual notice of change letter. Look at that letter. Read that letter. If you don't get it, call your insurance company by the end of September and demand that they send it, because by law, they're supposed to send it to you. That is going to tell you what your drug plan looks like for 2025 and how it's going to change for 2026. And again, this year, many people are going to find out that their drug plan doubled or tripled in price. I hope they find out. I hope they read this letter so they can make a change if they want to make a change. Now, this is the bad news on top of the bad news, and that is you might want to change, but you might not find a plan to change to that is cheaper than what yours is going up. You might be stuck. And that is because Medicare Part D for last year was subsidized by the government. So the drug insurance companies got money from the government to keep the prices low in an election year, because that was a really bad look right before an election to have everybody's drug prices skyrocket. So even though some people still doubled and tripled, it would have been way worse than that without the really hefty government subsidy. Now, last year, the government said if you want to participate in this subsidy, you got to meet certain requirements. One of them is you can't raise your plan more than $35 above what your plan was in 2024. So if your plan was $0 in 2024 and you went to $35, people were mad. Well, this year, the government says if you want to continue to participate in the subsidy got slimmer, that you can't raise your plan more than $50 for 2026, more than 2025 rates. So if your plan goes up $50 a month, that's a lot. That's a game changer for a lot of people. And they're going to say, can I afford to stay on my Medicare supplement with my separate drug plan? Or basically financially, am I now forced into a Medicare Advantage plan where I really didn't want to be? Some people will say, no, I do not want to be in a Medicare Advantage plan. I will keep my Medicare supplement plan, but I'm healthy. I hardly take any drugs, or if I do, it's a really cheap thyroid medicine, or I get it with a good RX discount card. So I'm just going to drop my drug benefit, my Medicare Part D benefit. And unfortunately, I think we will see many people go that route this year. Now, I don't recommend that, because just because you're healthy now and you're taking cheap drugs now doesn't mean that you won't be diagnosed with some horrible condition and be needing a very expensive drug in a month, right? Life changes on a dime. The most expensive drug in America is $4.4 million. Of the top 10 most expensive drugs in America this year, the 10th most expensive is still $2 million. Now, if you have a Medicare Part D drug plan, the most you can pay for drugs covered by your insurance plan is $2,000 this year. It's going up slightly to $2,100 for 2026. So if you get sick, you're going to want that protection. Like I said, you don't know if you're going to get sick. You don't know how expensive of drugs you want to take, but insurance is for the unknown. If you knew you were never going to get in a car wreck, you wouldn't pay monthly to insure your car, right? If you knew your house was never going to have a claim, you wouldn't waste money on it. We do it because insurance is for the unknown. So one of the most important things you have is your health, okay? The most important thing you have. So I really highly recommend against dropping your drug coverage. Now, a lot of people are going to drop it anyway because they don't work with an advisor like the Medicare Family. They're going to just say, they're just going to do it without learning about the repercussions. The repercussions is, sure, you can get it back later. You can call us in 2, 3, 4 years whenever you I mean, knock on wood, whenever you do need it again, and you can get back in the system. Now, you can only sign up again during the fall, unless there's a special exception, but you'll get a penalty. You'll get a penalty for every year that you were eligible to have a drug plan that you did not have one. So if you drop it this year and you want it back in 3 years, you're probably going to pay about 30% more every month when you do pick it up again. Now, it's not cost prohibitive, and I think a lot of people, when they do that math, they're gonna crunch those numbers and go, I can live with that. We don't know exactly what that penalty will look like, because we don't know exactly what Part D the average national premium will be. It was about $32 for years. Right now it's about $38, $39. That's what they base the penalty off of. If you want to know more about how they compute that exactly, try to figure out what that penalty would look like, you can get my book on Amazon, Medicare Mama's Guide to Medicare and Social Security Retirement. I go into all how the sausage is made to figure out that penalty. What would I do? Everything that everybody does is based on our individual health and our individual budget. So if I was a really healthy person, again, not taking any medication, or like I said, taking a few cheap ones, I would think hard about dropping it too if my budget was tight, and an extra $50, $60 a month for a drug plan that I wouldn't use would be crunching me. So as an agent, insurance professional, I have to recommend don't go without insurance. But I know some people they're gonna do that. Insurance is all about risk. It's all taking the dice and rolling the dice. So if you do that, you're rolling the dice that you're going to stay healthy, and you're not needing expensive drugs, and that you can get back in the program later. So it's always a personal decision. There is no one right way. People are gonna scare you and say, you have to keep your drug coverage. Well, that's easy to say if you can afford it. So look for those letters. That letter will come by law. You have to get it by the end of September each year. It's called your annual notice of change letter. It's going to show you what your drug plan looks like for 2025, how it's going to change for 2026. Now, what it can't tell you is, with certainty, is what the drug copays will be. Now, they can tell you what they project they're going to be, but then they can change it. So if they say, oh, your atorvastatin is going to be a tier 2 drug and your copay is $40, they can change that in February, and now it's $50. So now we don't cover atorvastatin. So a lot of those parts of the Part D drug plan, they're moving around. It's really frustrating. The thing that won't change is your premium. If you stay on that plan or you enroll in a Part D drug plan, it's going to stay the same. The premium cannot change for a calendar year. And then every year you'll be playing this game again, where you wait for the annual notice of change letter for what it's going to do for the next year. And again, do you keep your cards? Do you fold them? Do you hold them? Do you look for a new drug plan for the next year? If you need help with Medicare, that's what we do. Our family, the Medicare Family, we're a third-generation family business. We're located in central Indiana, but we're licensed in all 50 states. Wherever you live, we can help you. Our help is free because we're independent contractors for dozens and dozens of insurance companies, all the big names that you know in insurance. If you want to learn more about retirement, Medicare, Social Security, give us a follow or subscribe to our channel. Thanks. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.